Good morning, everyone. I'd like to welcome everyone to the Precision Health and Integrated Diagnostics Center 2021 Symposium. My name is Garry Gold. I'm the Interim Chair for Radiology at Stanford and the Director of the PHIND Center at Stanford. I'd like to start out by acknowledging my friend and colleague and mentor, Dr. Sanjeev Sam Gambhir, who we lost last year tragically to cancer at a young age. Sam was a visionary, an inspiring leader, and has really helped craft and define the message of precision health and integrated diagnostics as we move forward here. We all miss him dearly. I'd like to thank you for joining us today. A few housekeeping notes. Please use Slido for event discussions. Slido can be found to the right of your video feed or at slido.com with the event code #PHIND. Questions will be asked after each session by our moderator, Dr. Ryan Spittler, the Deputy Director of the PHIND and Canary Centers at Stanford. And most sessions are being recorded and will be posted on the PHIND website in the coming weeks. Precision health begins with risk assessment at all stages of life, looking at family history, genetic screening, and socioeconomic factors which play into the formation of disease. We follow this with customized monitoring using diagnostic tools, including smart home devices, wearables, biomarkers, imaging, and implantable technology. Combine the risk assessment with the monitoring with data analytics, including pattern recognition and machine learning approaches, and you have the basis for intervention with doctor visits, coaching and support, and behavior changes, including precision medicine and testing to keep people healthy. So this is really a vision of lifelong surveillance, learning, and adaptation to keep people healthy throughout their entire life, rather than waiting for disease to manifest itself at a late stage and treating it when the treatment is less likely to be successful. Our research areas in the Precision Health and Integrated Diagnostics Center include informatics, wearables, sensors, biomarkers, and health economics of diagnostic tests. This was Sam's vision for precision health, continuously monitoring the patient to predict, prevent, diagnose, and cure disease precisely. Our space at Stanford is at 1701 Page Mill Road. To date, we've funded 7 Dream Team projects, 37 seed projects. We have nearly 100 associate faculty members representing 48 departments across the campus. And once we reach the post-COVID period, we anticipate hiring 10 new faculty into this center. The center is located in the Research Park in Palo Alto, which is close to the Canary Center and also close to an incubator that will be used to translate some of the discoveries made by the faculty associated with PHIND. This year, we held another seed round of funding in 2021 and awarded 10 proposals in fundamental studies of biology of disease, biomarker research, diagnostic technology, and precision health economics. A few examples of the new awards are shown here. This is a study by Akshay Chowdhury in the Department of Radiology. Whenever we get an abdominal CT scan on a patient, there's actually a lot of information there about that subject that really isn't used in its current diagnostic form. So using a combination of machine learning and correlation with the electronic medical record and radiology report, Akshay and his team intend to be able to predict frailty based upon the results of the CT scan, which is really something we don't look for in the clinical read of the CT scan. This is a project by Chetan Khosla looking at urinary peptidomic biomarkers for non-invasive detection of celiac disease. Celiac disease has a prevalence of 1% and develops as a result of inappropriate immune response to gluten-derived peptides from dietary wheat, rye, and barley. Right now, the only treatment for celiac disease is essentially a gluten-free diet where you avoid these types of dietary products. Chetan and his team are looking to figure out, based on urinary peptides, which patients have celiac disease and which do not. This is a study by Alison Okamura using the smartphone that nearly every one of us own these days to develop a mobile application using the haptic actuators in the smartphone to conduct vibration sensory tests. This would allow telehealth visits and an accurate, cost-effective method for really anyone, normal subjects or patients, to conduct their own at-home sensory test. From Michael Snyder in the Department of Genetics, a project to develop an exposometer for precision environmental health. We know that exposure to many different environmental effects, such as air pollution, smoking, infection, can place us at risk for various diseases. But right now, we don't have a good way to measure what those exposures are. Michael's team intends to develop a wearable exposometer for monitoring of these exposures to the environment. Kathy Ferrara in the Department of Radiology is developing and using in vivo photoacoustic imaging to characterize atherosclerotic plaque in the carotid artery. This will hopefully be able to determine which patient's plaque is at risk for rupture and therefore a problem with blood flow to the brain, and which plaques are more benign and can simply be monitored. Finally, from Joe Wu, his group proposed a deep learning platform for early detection of cardiovascular disease, looking specifically for a condition called left ventricular non-compaction, or LVNC. This is one of the leading causes of cardiomyopathy in young patients. And this project has a personal connection for me. In our next speaker's talk for Ken Mahaffey, who will speak about baseline, my wife was diagnosed with left ventricular non-compaction, which placed my children at risk for cardiomyopathy. They were subsequently screened and found out to be fine, but this is an area where precision health can really make a difference in people's lives. I'd like to announce that, funded from a generous gift by the Philips Corporation, we are looking for the initial Sanjeev Samgambhir Fellows in Precision Health, which will be awarded next month, looking at, again, areas around precision health and integrated diagnostics. Will award up to 2 postdoctoral fellowships per year. So really our FIND vision here is to work on novel technology and data acquisition methods, novel data analysis and integration tools to monitor people, and then test clinical implementation of these devices in clinical studies and trials. Up next in our symposium is my good friend and the principal investigator for the baseline study, Ken Mahaffey, who's a professor of cardiovascular medicine and vice chair of clinical research in the Department of Medicine. Ken, thank you, and looking forward to your talk.